Welcome to Hack Your Health with Dr. Nat, a transformative live stream TV show that brings wellness within everyone's reach. Each episode, featuring expert guests, delves into crucial topics like hormonal health, effective detoxification, and stress management through nervous system optimization. Gain practical insights into nutrition, supplementation, efficient workouts, and biohacking tools to enhance mental and physical health. So now, please welcome the host of Hack Your Health, Dr. Nat.
Hello, everyone, and welcome to Hack Your Health with Dr. Nat. I'm your host, Dr. Nathalie Beauchamp. The purpose of the show is to bring you interesting guests and topic. And today I'm super excited about this conversation. The title for the show today is Everyday Champion, Athlete Level Health Tools for All of Us. So my guest is Dr. David Duizer. And what we're going to do today is that Dr. Duizer uses in his practice a lot of interesting tools. So we're going to talk about some of the tools that he's using with his athletes, but that we can benefit from. We're also going to discuss nutrition, more exercise in depth. But the goal for today is for us to learn how athletes build their resilience, but how we can build our resilience as well. So welcome to the show, Dr. Duizer.
Thanks so much. I'm so grateful to be here.
Cool. I'm gonna read your bio here, and then if you want to extend on your bio. So you're a naturopathic doctor who grew up in Nova Scotia, Canada, and you were excelling in basketball at the Royal Military College and Academia as well, where you earn your BSc with a double major in chemistry and psychology. Again, at athletic background there. And after his time at RMC, Dr. Duizer served as an officer in the Canadian Navy, further developing obviously his leadership skills. Then he transitioned into a healthcare career where he completed his naturopathic physician training at the Boucher Institute of Naturopathic Medicine in 2014, and also launching his health clinic with his wife. He is currently a partner at Noble Naturopathic Clinic. He is also the chairman of the board at the Canadian College of Naturopathic Medicine and also teaches at the Institute of Holistic Nutrition. Obviously, a well sought after speaker, and I know he can talk on many different topics. I was fortunate to be interviewed by him a few months ago on one of his podcasts. So welcome, Dr. David.
Thank you very much.
So anything you want to add? Pardon me?
Shout out to all those institutions as well.
Yes.
When you review it like that, you bring back some good memories and some bad ones.
Yes. Anything you want to add with your journey to, obviously you went in the military and more chemistry. Obviously you were interested in the human body. Is it what decided you to kind of change course? Was it something personal? Was it something that, you felt called to?
No, I wasn't. I always wanted to be in healthcare. I wasn't sure if I would be a military physician or if I would be out in private practice as a conventional doctor. I never knew about naturopathic medicine growing up. I worked in a chiropractic clinic, and I developed an interest in integrative medicine and an interest in supporting people using nutrition and exercise. And when I moved to the West Coast, I discovered that this was a career that a person could actually take on and have a nice scope of practice. And so I decided to pivot and become a naturopathic physician.
That's awesome. So as I mentioned earlier, we're going to talk about some pretty neat tools that you have in your practice, which, I'm not sure if you set it up that way to focus more on athletes, but now I hate to say it, but your regular patient can also benefit from that. So let's start, first of all, some of the tools that you're using are obviously for performance, and some are for, better resilience. And we're looking at longevity now more and more because we want to stay fit and, look good and all of that stuff. But at the end of the day, we are training to live longer and have a great quality of life, because there's a huge difference between health span and lifespan. So let's dig into the first one, which I'm sure you can talk about for quite some time. I'd explain your VO2 test and that you do on a lot of your athletes, but also transitioning to some of your clients. So tell the audience what the heck is a VO2 max and what can we gain from that test?
Well, I'd like to start by saying I never thought I'd work with athletes. I mean, I'm 10 years into my practice. I wanted to work with athletes initially, but never thought that there would be a space for a naturopathic physician to actually work with the athletic population. So my first 7 years are completely in chronic disease management. And in fact, it's a big part of my practice today. We do a lot of chronic disease management and chronic disease prevention. And so about 6 years into my career, I was going through objective data for, someone who had cardiovascular disease and trying to think of like the most important number to reduce the risk of a second event. And I came across this journal in the American Heart Association journal, Atherosclerosis, that said VO2 max is the number one predictor of health of lifespan, and it's more important as a measure than cholesterol and blood sugar and inflammation scores. And then it said, and it can be tested in the office. And I thought to myself, how can VO2 max be tested in the office? I knew that physiology departments at major universities assess for VO2 max. And in other countries, physiologists have their own practices, but it's not a very common thing here in Canada. And so I immediately, within that day, was able to find a mobile device that was suitable to a practice like mine. And I started testing VO2 max within the next few months. And so by my 7th year of practice, I started doing VO2 max assessments for people who had chronic disease or were looking to prevent chronic disease, because the fittest people live the longest regardless of their diagnosis. And so we have been doing it for a very long time now. We're almost 4 years in, and that was the patient population we started with. Then it evolved to athletes. So we went from there to working with an athletic population. And then from there, really, it's evolved into a space where we can efficiently create deficit meal and exercise plans. So we do a ton of obesity management in our practice. But VO2 max is the coolest test. It measures the oxygen consumed by the body per minute of time divided by how much someone weighs. It gives us a number. And it's used in combines for major sports. So they'll assess someone's cardiovascular capability by a VO2 max. For example, if you're comparing yourself to athletes, you'll see that the NHL combine, the top athlete was a 61. Top point guards in NCAA basketball are at 61. Your top endurance athletes, the number one marathoners, are in the 80s and 90s. And the sort of healthy number for most people, although there are age-dependent ranges to think about, healthy numbers are above 40, elite numbers are above 50, and athletic levels are above 60 for VO2 max.
And that's important because people are probably wondering, well, why is this important? It's important because as we age, I can't remember exactly the exact number, but I wrote a blog on it about a month ago that, in order for someone to get up, to get dressed and take care of themselves and cook for themselves, I believe it was at least 15 to 20, correct me if I'm wrong, in VO2 max for someone to be able to do those basic tasks. So if we're already starting, when someone gets tested, they're in their 50s and 60s and they're already like low 30, then you're like, wow, if I keep declining like this, something, is going to happen. So I think it's really cool that it's such easy test, really, but it's a very important number. And I'll repeat what you said to make sure people got it, that it is as important in terms of predicting how long we're going to live as it is a cholesterol number. So it is very important. So it's underutilized. So you use
completely. And let me say a little bit more about me, if you don't mind, Dr. Nat.
Yeah,
The other reason I love it is because you get to see the entire cascade. This is part of our test, but really when you're looking at VO2 max, you're assessing oxygen consumption and the speed of oxygen consumption. But the reason I love it is because oxygen consumption is so multifaceted. Like the air has to come in, the lungs have to send it to the blood has to go be pumped by the heart to the tissues. You have to have enough capillaries supplying the muscles to get the oxygen from the blood into the muscles. And then within the muscles, you have to have mitochondria that can consume the oxygen and produce energy. And you could have lots of mitochondria, you could have a small amount, you could have very high functioning mitochondria or poor functioning mitochondria. And so you could have tons of muscle mass where this mitochondria lives, or you could have a small amount. So we talked about the lungs, we talked about the heart, the blood vessels, the tiny blood vessels, the capillaries, the muscle volume, and the mitochondrial density and function within that muscle. So there's a huge amount of opportunities for optimization within this entire chain. And then to get a really, really, really important number like VO2 max, you would take that oxygen consumption and divide it by someone's weight, because obesity is a significant risk factor for mortality. And so that's the coolest thing. Someone could be an equal amount fit but lose weight and have a higher VO2 max. They could maintain their weight but get fitter and have a higher VO2 max, or they could do both and have exponential change in their VO2 max.
Yeah, and I think it's important what we measure, we can focus on. And there's nothing like numbers to have a goal and notice our improvement. So if I'm not mistaken, you're using the PNOE metabolic testing instrument, correct?
We do. We use the PNOE. Yeah, it's a sensor device, sensor to pack, to Bluetooth, to the iPad, to the cloud, where we have a portal. We can watch the data, and then we get really cool reports that give us resting metabolic rate, and on the VO2 max, 10 different scores, including VO2 max number, but 9 other scores that help us find limitations so we can help to improve it.
Yeah. And it's also, it can be done at rest and it can be done at exercise, correct?
Well, yeah, the resting test gives you your resting metabolic rate, and that's how we make meal plans. So we need to know how much food a person needs, whether they're trying to lose weight or maintain or gain muscle. We need to be able to feed them appropriately. So the resting test is what we use as a guide for our meal planning.
Yeah, and a lot of people sometimes are confused. I don't know how many calories I need. Well, a test like this takes the guesswork out of it. And then for the exercise part, you can do it on the bike, the bike, the treadmill, and rowing.
Rowing, air bike, really anything. We do it outside. We've done it on a basketball court. Because it's a mobile device, typically these tests are done in university settings or in physiology departments where it's a chamber test. So it's hooked up to a tube, which goes to a chamber and then connected to a computer. So it's quite limited, but with ours, because it's mobile, we can go and do really cool things.
Yeah, that's awesome. And it's not as expensive as one would think to get those tests done. You just have to figure out, if you're not local to you have to figure out who has this type of equipment and this type of device. Would you suggest, depending on who you're working with, if it's somebody that just wants it for wellness, that once a year is a good, range to get tested for that?
Completely. We talk about it like we talk about oral health. Everyone's going to the dentist every 6 months because we know the importance of oral health. If there's a dental infection, it can quite quickly spread to the heart and cause issues. Well, being deconditioned causes significant issues. And so we need to keep track of this number and keep track of what limitations are arising, what ones we're working on, if we're getting benefit from the training that we're doing, so that we can adapt over time. So we suggest every 6 to 12 months for a test.
Yeah. And you can guide people too if they need to work on their longer endurance or their short-term burst exercise and strength training and so forth with the data that you're collecting.
That's the really cool thing about VO2 max tests, right? We get scores for lung, heart, and muscle. Basically, how we determine what we should be doing is based on ratios and total volumes. So for example, in total volumes, we might be talking about liters of oxygen per breath. The device has a sensor that can measure how much oxygen is actually coming in per breath. We want to have really high lung volumes, right? We want to be able to pull in a lot of air. So that's one of our lung scores. Another one would be oxygen consumed by the body per breath. So when someone's breathing really fast, is their rate of consumption staying stable, or is it declining because the breaths are becoming inefficient or the body's becoming inefficient in the consumption of that oxygen? On the heart side, we look at oxygen consumed per heart rate. So the consumption of oxygen to produce energy divided by that heart rate number. As the heart rate rises, is the oxygen consumption staying too flat? It needs to rise exponentially. That tells us about how the body's responding to the demand. Is the heart rate appropriate for the actual intensity of that portion of the test? On the efficiency side, we look at metabolic and mechanical efficiency. So this is the coolest thing. How many calories is a person burning? So if, for example, they're an endurance athlete and they're burning 10 calories a minute at low intensities, they're going to be too fatigued to achieve the goal that they'd like to be, which is to be as fast as possible for as long as possible. That being said, if someone's trying to lose weight, that's a good thing, to be burning a ton of calories at low intensities. On the top end, it's the same thing. If someone is going all out, but burning more calories than we would think they should be for their height, for that speed or that wattage on the bike, then that means they're inefficient at high intensities, and speed work is going to be more appropriate for them at that current time. So calorie burn is how we track the efficiency of the person. Basically, for endurance athletes, we're trying to race in zone 3, train in zone 2, speed work in zones 4 and 5. If they're burning too many calories in zone 3, well, maybe zone 2 is not the right place for them to be training for their endurance work. Maybe we would train a little more in zone 3 at race pace and see if we can improve efficiency. You see what I'm saying? For someone who's just trying to become the fittest they could possibly be and live the longest, of course, we do the same thing, but with lower strictness. Our athletes are very strict. They're training 6 days a week. For everyone else, it's what's the evidence for this program to cause a physiologic change? Say they can only do 3 days a week. What should we be doing within those 3 days a week? And where's the evidence to suggest it's going to work? That's how we tailor it. If they can only do 2 days a week, what would that look like? If they can do like an athlete's plan, then we have more opportunity, of course, for different physiologic changes at the same time. So we use all the data to do our programming. And that's why, we went and we developed expertise in strength and conditioning, get a certification in strength and conditioning to be able to write effective programs. But yeah, it's really fun. So lots of different opportunities for removing limitations. I'll tell you the most common thing that happens with our agility athletes or the short burst athletes is their aerobic capacity is not as great. So their low end training is not as efficient. The most common thing that happens with our endurance athletes is they need more speed work. They're not doing their speed work appropriately, the frequency and intensity. The most common thing that comes in with people who aren't exercising at all is that they're burning actually a pretty decent amount of calorie at low intensities, and they just need to train to achieve a bit of a deeper deficit. See what I'm saying?
Yeah. So on that note, people may not completely know what we're referring to when we're talking about the 5 zones. So if you don't mind explaining a little bit of that, and point being is that I think people are more and more aware of the terminology, and that we should have, 150 minutes a week of zone 2 cardiovascular exercise. And even myself, I go for a walk with my weighted vest. I jog a little bit. If I don't have anything to measure my heart rate, I'm kind of guessing, am I in zone 2, am I in zone 3? Like, it gets a little bit tricky. So do you mind just giving us a brief overview of those zones?
Oh, completely. Yeah. Zone 1 is no intensity. So it's leisurely walking. Zone 2 would be sort of where the fat burning is maximized, and we're going all the way until the carb burning, which this is how metabolism works. I should probably start with that framework. When times are easy, we burn fat. When times are hard, we burn stored carbohydrates in the form of glycogen. Zones 1 through 3 are those easier zones, the low intensity work. Zone 1, leisure walk. Nothing really is happening. It's all fat burning. In zone 2, we're burning fat. We reach our fat max. We're burning the most fat. And the carb burning is starting to creep up, but it hasn't crossed over yet. It hasn't becoming the prominent fuel source. Zone 3 is where the carbohydrate and fat are both being burned, but carb is starting to become more of a predominant fuel source. And that zone 3 goes all the way until the lactate level crosses 2 millimolar. The lactic acid builds up, the hydrogen ions come with it. When the lactate crosses the 2 millimolar and makes an exponential rise, so it's no longer stable, then we've entered into zone 4. So that's the end of zone 3. On our test, we use the breathing drive to tell that to most people, although we do have a lactate monitor. And for our athletes, we measure lactate to make sure we get the zone 4 exactly perfect. And zone 5 is when we are all out. We're burning only glycogen stores and we're maximizing our output. So those are zones 1 through 5.
Perfect. Thank you. And it's reminding me of my days in university, because that's what I was doing in the physiology lab, is testing
Amazing.
athletes. So I remember testing the Canadian boxing team, and the lactate test is just a pinprick to the finger, but this big dude, didn't like needles, and I remember him passing out on the treadmill. It was kind of. No, it wasn't fun, but I don't know how many years later it's still sticking to my mind.
Oh my God, listen, okay. Most people don't pass out. Most people don't pass out. So we have this awesome protocol where we do the Norwegian method. So the Norwegian method, we do a lactate threshold test. So basically, instead of doing a 1-minute ramps on a VO2 max test every minute, the test would become more difficult. The pedals would get heavier on the bike, or the speed would get higher on the treadmill. For lactate assessments, we have the monitor. It's a finger prick test, like you mentioned. But instead of every minute, it's every 3 minutes. You do a certain pace for 3 minutes. You stop, take a minute off. We do a blood test, see what the lactate level is. In zones 2 and 3, that lactate level is very stable between 1.5 and 2. We do 3 minutes higher, more difficult. Stop for a minute, test the lactate again. See if it's still stable between 1.5 and 2. 3 more minutes, harder. Stop for a minute, test again, see where it's gone. Oh gosh, it's gone from 2 to 3.2. Okay, we've crossed over into zone 4. 3 more minutes. Stop for a minute, test again. Test the lactate. It's a way above 4. It's 5, 6, something like that. And so that's how that lactate test goes. And then what the Norwegian 1500 meter runners do is then they use that lactate threshold to do their speed work. 2 days a week, they do 2 a days, 30 minutes in the morning, 30 minutes at night. And what they do in the morning is they do 6 minutes in zone 4 and then 1 minute off, or zone 1 or 2, repeat for 30 minutes. In the afternoon, they do 3 minutes, 3 minutes zone 4, right at that lactate threshold. 3 minutes zone 4, 1 minute off, or 1 minute in zone 1 or 2, over and over for 30 minutes. They do that twice a week. And the rest of the week, they just run in zone 2 as long as they possibly can.
Yeah. And people have to see this, as I said, like for athletes, and even people that, maybe are amateur, that, are doing activities and they just want to do better. And again, for the people that just want to live longer and make sure that they have the VO2 max to support it. So let's dive into another technology that I'm quite familiar with as well, is the in-body bioelectrical impedance test. So measuring our body composition. And I think every doctor's office, that it is a naturopath or a medical doctor, should have that in their office, because it does give so much information. And on top of that, one of the newest model even comes with grip strength. So grip strength, again, a huge correlation with longevity as well. So I know you have one in your office. So tell me how it works and how you're using it with your patients.
So InBody is a bioimpedance scale, and people may be familiar with them because they are available. The ones for just the feet are available all over the place. But when you just do the feet, you miss out on so much. So InBody is great because it's doing, upper and lower body at the same time. And it's got advanced technology within, sending a signal through the body. The signal reflects off the cells back to the sensors. And depending on that reflection, the scale will be able to read if it's water, fat, or muscle. And so with InBody Scan, we get to see those 3 types of tissues, and you get to see exactly where they are in the body. So segmental analysis for both fat and muscle. And so we use that for our tracking tool for everybody. It's ridiculously important. If you've ever been on a weight loss plan before and you have felt like you've actually gained weight in the first few days, then you know the frustration that can happen not actually tracking body composition appropriately. So InBody kind of removes that. If you're a cycling female and you notice that at different times of the month, your body composition is completely different, well, that's trackable on an InBody scale. It's incredibly helpful for that. So we know that we want to be maximizing muscle mass while being mindful of the impact of weight on the joints. And when we have an athlete, for example, we want to be maximizing muscle mass, but also that mitochondrial density and efficiency within the muscle without becoming too slow because we've gotten heavier. And in weight loss, of course, we're tracking muscle mass. And if it's at the 100th percentile or better, we're maintaining, and we're working on adiposity change or the reduction of fat tissue. And we typically will use the resting rate analysis to determine if we actually should be gaining muscle in scenarios where we're working on weight loss, because muscle drives metabolism at rest more than anything. So the in-body scale tells us if we should be focusing on the building of muscle or not. And a really cool example of this is we just had a person lose 100 pounds over the course of a year. And within that 100 pounds they lost 95 pounds of fat and 5 pounds of muscle. And their resting rate has only gone down 200 calories per day. And that might seem like a lot to you, but it's really not a lot given that 1/3 of their body is gone. So that tells us really that fat tissue is not active. It doesn't make energy at all, very, very small amounts, but muscle tissue really does. I think that 5 pounds of muscle that that person lost accounts for most of that resting metabolism loss. So think about it in the opposite way, right? Someone needs to burn more calories. Putting on muscle can be incredibly valuable. So a lot of the weight loss plans you'll see out there will be focused on muscle building. The issue is that it makes people hungry, and then they end up eating more. And of course, nutrition is ridiculously important in weight loss. And so we have to manage both. We've had some success, lots of success actually, with turning fat into muscle. And we use the in-body to track that. I wanted to give a case about VO2 max before we moved on, Dr. Nat.
Oh,
Too. I
yeah,
just
that'd be great.
this
Please.
week,
That would
just
be
because I
great.
had someone come back this week and their VO2 max went from 43 to 56 in 1 year. So doing this
Wow.
1-year test has been really helpful. This is a very typical example that I see in my practice. CrossFit athlete, trains really hard, really, really fit, good VO2 max in the 40s, needs to work on low intensity work because of course CrossFit is high intensity work. We build in zone 2 training 2 days a week. They do 2 or 3 days a week for a whole year. Their VO2 max jumps over 10 points in 12 months. And getting 1 point per month is what we try to do. This person had very minimal body composition change. This was all because they got fitter. And I just love that. That's the best part, to see, major change with in VO2 max with just simple changes. Sorry, I took us away from the in-body scale.
No, that's fine. And
That's
actually,
important.
it is important. And I think we get motivated by people's story, that it is weight loss or just changing their lifestyle or exercising more and so forth. So let's take a quick break, and then we will come back to the in-body and muscle mass and weight distribution and so forth, because I think it's an important topic. So we'll be right back.
In today's world, the flood of health information feels endless. But amidst the noise, 2 experts with over 50 years of combined clinical experience come together to help you with Smart Cuts, Biohack Your Health Span, cutting-edge protocols for greater energy and performance. Dr. Paul Sly, a beacon for athletes, weekend warriors, and those seeking to elevate their potential. And Dr. Nathalie Beauchamp, renowned for empowering individuals in their health journeys. Together, they've produced the book, Smart Cuts, Biohack Your Health Span, a protocol-based treasure trove packed with actionable steps. Journey through 5 transformative sections. Dive into sleep, hydration, movement, brain health, and even the secrets of longevity. Guided by their expert hands, unleash the best version of yourself. With over half a century of clinical wisdom and innovative protocols, reclaim your health and redefine your limits. Are you ready to embark on this transformative journey? Smart Cuts, available now.
And welcome again to Hack Your Health with Dr. Nat. I am with my guest, Dr. David Duizer, and we are talking about cool tools for not just athletic performance, but for us to be able to live longer. So we're going to continue where we were with the in-body bioelectrical impedance analysis. And, we talked about the benefit, but one of the things I think is important to mention is visceral fat. And I just got mine done about a month ago, actually, since we last spoke, David. And I was pretty happy with the results. And each time that I do it, the machines get even, like I said, the grip strength, even the lean body per limb, so you can see. And sometimes, especially female, let's face it, a lot of female do not work out their upper body, so it's good information to have to help guide a woman into her training program. So how are you using it to the extent of the visceral fat? I'm guessing this is a conversation that you most likely have, right?
We do. We even have it with our athletes. Yeah, visceral fat is very dangerous. So by the way, this is fat around the organs. You may be familiar with non-alcoholic fatty liver disease. It's becoming incredibly common, and we use this tool to track because ultrasounds can be difficult to gain in our province, and
Yeah.
it's really helpful to see it. And not everyone has the same distribution of fat loss. So when someone creates a deficit meal and exercise plan, sometimes they lose more peripheral fat, like fat on the limbs, and sometimes they lose more visceral fat initially. Typically, on the in-body scale, it's measured as a level, and these levels correlate to about 4 or 5 pounds per point. And so we watch that, and we try to go for what we call a level 5. Level 10 we call normal. But really what we're doing is we're trying to maximize for body fat percentage while looking at visceral fat. And so for females, we're looking at body fat percentages somewhere between 20 and 28, typically landing around 23, 24. And for males, we're looking between 10 and 20%, typically landing around level 15% body fat. And when we get into those normal ranges, the visceral fat level typically comes below 10. And for certain populations, it might be more difficult to achieve that than others. For me personally, I lose visceral fat first, but I maintain peripheral fat quite evenly distributed throughout my body, whereas other people, it may be different. And this is why it's really, really important to track this, because visceral fat is very dangerous, fat around the organs, especially the liver, because when there's visceral fat on the liver, then insulin resistance, the inability to control blood sugar using the hormone insulin, is more prominent. And this is something that is amenable to lifestyle change. So when we change lifestyle, we could reduce visceral fat and therefore sensitize ourselves to blood sugar using that hormone insulin more efficiently. So it's really, really important for disease prevention, because of course that condition is associated with all metabolic conditions like cardiovascular disease and cancer. So we like to track that one.
Yeah, and let's talk a bit about mindset about this, because my goodness, I've seen it all, I think, throughout my 27 years in practice. Even me as a chiropractor, we would do screenings at the mall and say, oh, can we check your posture? And people would say, oh, I know it's bad, I don't want to know. And it's kind of the same thing that applies to, body fat percentage like this. I think people are intimidated. They almost don't want to know the results. What if it's bad, and so forth. And I can understand, like, I can really understand, but we have to look at it differently. Like, when you know where you are, you can more easily be guided and make changes to move yourself forward. So ignorance is definitely not a bliss with this. So hopefully people listening are just, keeping an open mind that these tools are available to you. And that's part of why I wanted you to talk about this, because even from a blood work point of view, naturopathic doctor and functional medicine doctors have access to so many other tests that can be done that are not in our regular healthcare system. So it always makes me sad when I see patients that think they've got tested and they think that's it. This is the clean bill of health that they go for their physical, and it just makes me sad because it's such a false sense of security. It's a false sense that what you're doing is the right thing. So having access to those tools, yes, again, you do have to pay, but it's not that expensive when you think about it. And it gives you a goal. If you're starting a new meal plan, if you're starting a new workout, plus having people to guide you through it. Even Tiger Woods has a coach, right? Like, we all need coaches to keep us, accountable for that. So it just, I think, again, yeah.
I'm with you, Dr. Matt. I think you're right on. Like, but I totally get what people are coming from when they say, I don't want to know. I totally understand that. When I played basketball in college, like you said, and I actually led the country. I led the country of Canada in minutes played for college athletes in basketball for a whole
Wow.
season on the worst team in the country. So picture that, worst team in the country, played the most minutes, uh, had very high fitness scores. Of course, our college had fitness testing, and I
Yeah.
did very well on those tests. Then as soon as I left, I gained 50 pounds. I gained 50 pounds in real life after the military incredibly quickly, and thought it was actually really couldn't figure out why, did not
Mm.
understand why. And so I understand where people are coming from when they don't want to look at scales, because they have tried things before and it's not worked, and then been confused by the media and by public facing presenters about weight loss and
Mm.
healthy body composition who don't really understand physiology. People telling them that calorie deficits don't work. People telling them that you have to do a very specific thing to lose weight, and then it not working for them, and then becoming incredibly discouraged. So I totally understand it. It's difficult to look at the number when there's no real certainty around what to do about it. But
Yeah.
what we
Well,
try to do in our practice is we try to bring certainty, and
okay.
we do a pretty good job at that. Yeah.
Yeah. Yeah. Cool. Well, even when I hopped on the scale, I'm like, oh, okay, what is this going to say? Right. Like it just, and again, there's always room for improvement, but at least I know where I stand. So let's move on to a few other technology that you have in your office. One is the BioFlex photo biomodulation or red light therapy. I myself have this in the office for our patients. So I know we're using it a lot for arthritis and inflammation and seeing amazing results. So there's different devices. There's, the more expensive one that are more therapeutic, but there's also red light in general that works at a mitochondrial level, so infrared and red light. So how are you using your therapy in your office, and who's the clientele for it?
Absolutely. Yeah. We actually use the Iradia now. We don't use the Bioflex anymore. We have an Iradia laser, and we use three different ones. We've got a 904 nanometers, a 650 nanometers, and an 808 nanometers, all with different joule outputs. So with different energy outputs. So for people who don't know about lasers, the first numbers there refer to the wavelength, and that tells you about the depth of penetration that a light could have. And then the joules is the amount of energy that comes out. And so the higher the wavelength, the deeper the penetration of the laser, and the higher the joules, the more energy it can output. And what happens, photobiomodulation is really when you put light into cells, they function they function better, and to a certain point. Obviously you can damage with too much energy. So there's a real sweet spot where a treatment can occur, healing. And the typical things that we see with light therapy when we're actually we're doing this photobiomodulation, is we can drive blood flow, we can drive the suppression of pain signals, and we can lower inflammatory responses. And so with blood flow, we get healing factors. By reducing inflammatory responses, we can stop a destructive process that might be occurring, say, for example, in chronic inflammation. And by suppressing pain, we can bring back some mobility, and getting that physical therapy going is incredibly important for so many people with physical injury, but they can't do it because of pain. So
Mm.
we use this tool in all sorts of different realms, from arthritis pain to wound healing, to ulcerations inside the nostrils and inside the mouth, to post-concussion syndrome treatment. So ligaments, tendons, muscle bellies, uh, skin lesions, mucous membrane lesions, and brain support.
Yeah,
Yeah.
that's it. There's a multitude of different laser out there. I myself was at a conference in Montreal not too long ago with the Arconia laser, and I got one. I can't remember which one I had on my head. It was the brain protocol, and it's amazing. And again, it's technology that is here and that people don't know about. Another one that you use is a nutritional IV as well. So if you don't mind explaining what it is and the benefits and the different ones, please.
Yeah, well, we see a lot of people with malabsorption syndromes, people who can't absorb the nutrients they're consuming. We have people with eating disorders. We see people who have damage to the digestive tract, leaky gut, hyperintestinal permeability that we can actually measure. And so we see lots of people who don't have adequate nutrient levels. And we actually test nutrient levels, of course. We get to know them. We can bypass the digestive tract using IV therapy. And IV therapy has been around for a very, very long time. The Myers protocol, which a lot of naturopathic physicians use for water-soluble nutrients, has been around for decades and decades. And the reason it's still around is because people get so much benefit out of it. That's why. Advancements in the last decade or so will be the use of IV amino acids, so IV protein, the building blocks of protein. It can be transformational in mood disorders and poor recovery. In our practice, we do IV iron for people with severe iron deficiency anemia. We use intramuscular injections of fat-soluble vitamins like vitamin D for vitamin D deficiency, which can be a difficult one to fix and so incredibly important. So we've had tons of success with them. We use personalized care for IV therapy. That's my favorite way of approaching this, is only to use these with people who really cannot consume or absorb nutrients at the right level for what they need, and to try to base it on objective measures, to try to only use IVs when it actually is required because they have deficit or it is going to be very proven value for the condition they're dealing with, and then to be very conservative about the frequency and dosages, just to find the minimum effective dose and frequency for them. So it's complete personalized care, and we've gotten a ton of value out of it, especially, even I shouldn't say especially, but even recently with the addition of amino acid IVs, for people who have been under eating protein because of a condition or under absorbing protein because of a digestive disorder for a very, very long time. Life-changing to be able to get amino acid IVs. So yes, we've been using them for a very, very long time, and they're going to be so incredibly effective in chronic fatigue, in fibromyalgia, in malabsorption syndromes, digestive conditions.
So I think we've asked you about the cool tools that you have, but I think at the end of the day, you must see patients that are, like you said, chronic condition, and stress being a big one. So you've been in practice long enough. You probably have seen the effect of stress. I know I've seen it. So, kind of in conclusion of what we're talking about, what would you say people can do when they realize they want to take control of their health and they know they've been under a lot of stress? Like, it's almost kind of walk us through what you do at a patient in your office when they come in and they realize that they need to do something. Like, what's the typical assessment that you do? And because like you said, it is personalized, and I love that aspect, but people might be curious what it is like to work with a naturopathic doctor and someone like you.
Oh, completely. Oh, that's a great question. Yeah, stress management is a big part of most naturopathic physicians' practices. There's levels to this. We have the Hamilton Anxiety Scale, for example. So we'll assess for anxiety disorders using a evidence-based assessment tool. We will think about it very holistically. Is this an external stress? Mental, emotional, external, or internal? Is it a physical stress? And then what are the consequences of that stress? What is the symptomatology that's presenting? And what has been tried prior? What's worked? What hasn't? What's the severity? What's the frequency of the symptomatology? And when we think about quality, we might think about whether it's in the body or the mind. Is it ruminating thinking, or is it physical symptoms like shaking and sweating? So, you can get a lot out of subjective and objective assessments. And from there, we have the lab work. So we can go a little bit deeper in the objective side. For example, if it's stress that might be impacting their sleep and it's been chronic long-standing, we might think about adrenal function, not for Addison's and Cushing's disease, but for this adrenal overdrive or adrenal underproduction. And I think these two functional issues in stress are really important to actually test for, because the symptoms can be very similar in both cases. If you've ever run these tests before, you could know that someone could have ruminating thinking but have low cortisol.
Mm.
You know that someone could be depressed and feel very low, but have very high cortisol. So the opposite of what you can expect can occur. And so I find that lab test to be incredibly, incredibly valuable. Um, we think about the lifestyle, right? So what is the sleep hygiene? We talk quality and quantity, and we like to track, of course, because I'm obsessed with devices. And so for people who have Apple Watches and Samsung and Garmin's, we like to track deep and REM sleep in stress to make sure they're getting adequate amounts. We protect a darkness window. We try to fall asleep quickly and stay asleep for an adequate amount of time. We're looking for an hour to an hour and a half of both deep and REM, and to make up the rest with core light sleep. We like to obviously incorporate blood flow to help with endorphin release. So exercise at that
Mhm.
Health Canada recommended level of 150 minutes per week, low intensity, or 90 minutes high intensity. We like to think about a nutrient approach. We know there's really good evidence in stress for L-theanine as an amino acid, not perfectly comparable to medications for anxiety, but the safety profile is excellent compared to the medications, which the safety profile is poor. So L-theanine can be transformative. A herbal approach can be incredibly effective. There's really good evidence for lavender and passion flower. So we use those two herbs in stress, among other herbs that are potentials, but these ones have good evidence. So we like to use those. Nutrient deficiencies can cause the symptoms of stress. So, for example, someone with a B vitamin deficiency, like B12, for example, or B9, they can have symptoms of stress that's related to a deficiency. People with iron deficiency sometimes can feel really, really significant stress. And then when it comes to external stressors that are driving a mental emotional symptomatology, we have to think about that approach that we can take either with a team member or by yourself that is appropriate for the person. For some people, it's therapy. For some people,
Yeah.
it's virtual reality, mindfulness training.
Yeah.
For some people, it's sitting under a tree. Right. So it has to be individualized. I strongly believe that, and that might require us to try 3 or 4 things. Maybe you practice mindfulness for a while and you hate it. Maybe you do what I like, which is virtual reality therapy, and it's like amazing for you. But maybe you
Mhm.
really need to talk with someone and get tools that you've been instructed would be valuable for you from a professional. So referring to a counselor or a psychologist is a big part of our practice here. So multifaceted approach from physical movement to supplementation to actual therapy, I think would be the comprehensive way that we typically would build that here. And then of course we prescribe medicines in this province. And so if needed, we use medications for anxiety management when needed. Yeah.
That's good because I mean so many people are depressed sadly and anxious. So before we wrap up, I always like to ask my guest in our book Smart Cut, we talk about our non-negotiables. So what are your health non-negotiable daily, weekly, and monthly? So it's kind of a day in the day, a day in a day long. What do you do? My good, I can't speak. A day in the life of. That's what I wanted to say.
For me personally or for patients?
For you.
For me personally, okay, what
Yeah.
am I doing right now? All right. So right now I'm focused on appetite control because of my history. And people who have been athletes before may feel the same way as me. I think there's this this physiologic drive for people once they've reached a certain weight or had a certain energy output, either or. I think that the appetite centers try to keep a person at status quo. And so for me, I have a normal body fat percentage um, and a normal BMI, but it's work. I have to work at that. And without consciously focusing on consumption, I will go above in like 2 weeks because I have this drive to consume. And it's probably because, in the military, I was training. This is an excuse, by the way, but I was training hours and hours, 4 hours a day, minimum every day for 4 years. When you combine varsity athletics with military training,
Mhm.
which is very physical. So I think that for me, there's a non-negotiable is just to be in tune with appetite signaling. And a lot of people are noticing that now with the use of medications like semaglutide medications, that their appetite signaling has been so much higher than is required for their body type for so many years, that they're now just becoming in tune with, okay, I don't really need to have that much food. Something is driving me to do that.
Mm.
Part of it may be the system creating foods that combine salt, sugar, and fat that engage our taste buds in a way that is incredibly addictive. If you are someone like myself who is really drawn to delicious food, you would think, wow, this has been created for me. This is the perfect food for me. Staying in tune with that is a big part of my day. But then managing VO2 max is my lifelong thing. As you can probably tell from our discussion today, I'm obsessed with VO2 max because I really think it's the number one. It's the most important number in all of medicine and all of health. And not only has that been objectively decided amongst the deciders in longevity, the decision makers in longevity, but also you can tell it feels right. When you achieve a higher VO2 max from a lower VO2 max, the symptom changes are like more energy at rest. You feel better, feel more clear. There's less brain fog. There's more energy inside the muscles. Your get up and go is better. So people who have gone low VO2 max to high VO2 max, I think if you know any of them, you know that it feels better to be fitter. And that actually translates into a better lifespan, but also a better health span. We talked about muscle today, being able to have lots of muscle and use the muscle. The having is the volume and the using is the fitness. If you have it and you can use it, then your health span will be incredible. That means be able to do the things that you need to do or want to do for the longest possible time in your life.
I love that question because I think it's inspiring to hear other doctors and to hear other people. So we want people listening to this that we have to stay top of mind too with our health and are constantly, figuring things out for ourselves. So thank you so much, Dr. David, for your time. Love the discussion that we had. Can you tell people your website if they want to check, if they're close to you, if they want to check your website and check what your clinic is all about?
Absolutely. Yeah. My website is noblenaturopathic.com, and we can be contacted there. We can also be contacted through DMs on social networks like Instagram at Dr. Dr. David Duizer, Duizer, or at Noble Naturopathic. You can also contact us on Google through the contact form that's present within the map. You can we answer to that as well.
I'll make sure that I follow you too on Instagram. So thank you so much. So thank you everyone for tuning in to this episode. Hopefully, again, my goal with this show is to make you think and understand what is out there available to you, and hopefully help you take control of your health. So thank you so much, and we will see you at the next episode.
Welcome to Dr. Nathalie's 7-Day Hack Your Health Challenge. Transform your fitness level with 7 quick, do them from anywhere workouts. Look and feel great. Nutrition. Master the art of optimizing your diet and maximizing nutrient intake with daily nutrition challenges. Biohacking. Unlock exclusive content to tap into your body's innate wisdom. Take on challenges to optimize your mindset and physiology. Ready to transform your health? Visit www.dranat.life to join Dr. Nathalie's 7-Day Hack Your Health Challenge. Your journey begins now.
This has been Hack Your Health with Dr. Nat. Tune in each week and uncover simple yet powerful strategies and actionable steps to elevate your health and wellness.